My name is Judy Machira. I'm going to be presenting on the grand theory presentation for Regis College. It's a group work presentation, and we did this group work together with Lisa, Meredith, Shannon, and Caitlin. So our theorist was Virginia Henderson, who was born in Missouri, Kansas City in 1897. She was one of 8 children, and she graduated from the Army School of Nursing at Walter Reed Hospital in Washington, D.C. She worked at the Henry Street Nurse Services, and she taught at the Norfolk Protestant Hospital in Norfolk in Virginia. In 1932, she completed her bachelor's degree education from Teachers College at Columbia University. And then in 1934, she completed her master's in nursing education from Teachers College at Columbia University. In 1953, she was a research associate at Yale University School of Nursing. So she did a lot of work between then until 1996, March 19, when she died at the age of 97 years actually. So she was short of 100 years by 3 years, because apologize for that typo. She died at 97. So Virginia Henderson is known for many things that she did. In the other slide, you can see there's a link for her YouTube, and you can link to it and see her interview. There are many quotes that she did, and one of them is that she said that the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or to a peaceful death, that he or she would perform unaided if he or she had the necessary strength, will, or knowledge. There's another quote about that she did there. There are so many quotes, and you can just read it for yourself. And I guess you can agree with me that she was very wise nurse. About Henderson, she's written quite a few books, and this is a list. You got a live link to the most popular books. And this is just an obituary that was written about her when she died in 1997. You can read it. It says a memorial service will be held on Monday, May 6th for Virginia A. Henderson, a long-time researcher at the School of Nursing, whose textbooks are now used worldwide. Miss Henderson died March 19th in Brantford. She was 98 years old. Correction there. And the service will take place at 4 p.m. in that chapel. And then we can see where her memorial fund is in the Yale University in Connecticut. So that's a place you can go and find most of her work or support funds to support her. To continue, what was the worldview that influenced her theory? So Henderson graduated from the Army School, as we said earlier, and during that time, most hospitals relied on student nurses to perform patient care. Graduate nurses were emerging and in high demand for the military. The societal background at that time goes along with Henderson nursing theory, where they believed in the importance of remaining in the society and promoting independence. She believed that the nurse's function was to take care of the health and illness of a patient until they can do so independently, and also show them how to do it. After the World War II, nurses came to realize their importance, and there was a nurse shortage. And once a group of mostly women demanded, that is when they demanded their fair treatment. Nursing practice through the 1930s to 60s consisted of increased complexity in nursing practice. The profession and society had a push for more formal education and certification for nurses. What are the fundamental philosophies and disciplines that reflected this theorist's work? Henderson's work was influenced by Edward Thorndike, a behavioral psychologist. Thorndike was the first to apply psychological principles to the theory of learning. His law of effect stated that behavior followed by a positive consequence is likely to be repeated and vice versa. He also discussed the failure of educational systems to give attention and reward towards positive behaviors. Henderson's theory, based on human needs, is based on a biopsychosocial approach with 14 activities that assist the client towards physical and emotional independence. How these philosophical underpinnings influence the theory's development of the theory. Henderson's education focused on patients' needs, both physical and emotional. She believed nurses needed to be educated in both arts and sciences. The influence of societal and professional advances helped Henderson come to her theory based on human needs. Humans needed to be taken care of at the biopsychosocial level in order to gain independence, and nurses who function to help maintain this and promote good education is what she advocated for. Henderson's theory was useful in that it taught a concept of patient care organized and centered around the patient as a whole rather than centered around medical diagnosis. Her concepts and theories were published in several textbooks for nursing students between 1930 and 1960. So here we are going to give an example of a hypothetical patient care case using Henderson's theory. And it says a 72-year-old patient is in a rehabilitation center trying to recover from a stroke. This patient was previously independent and now needs help with activities of daily living. A treatment plan following Henderson's theory would be one that focuses on physiological, psychosocial needs as well as medical diagnosis. This care plan would implement the patient's baseline abilities into the way the patient is cared for. The patient care would focus on the level of independence that the patient wants to get back to so that the patient can gain back their independence and do so in an environment that is conducive to her or him and their emotional goals, physically and psychologically. The theory's testability is demonstrated in a study also where an elderly lady in the workforce was studied to see how her external factors contributed to her overall well-being. The study followed a 66-year-old librarian who worked full-time in data collection, and the data collection was collected by performing a physical examination and using clinical interviews. The data collection focused on the 14 basic needs of Virginia Henderson's theory. The data was obtained by subjective and objective data that focused on biological, psychological, spiritual, and social components and the physiological demands of an elderly person. The subject was monitored for 1 month and they met with her 3 times to evaluate results. The end results showed that by staying in the workforce, the subject was able to meet the basic psychological and social needs that she otherwise wouldn't be able to meet. The theory was applied by focusing on the 14 basic needs and how it affected the subject and her overall well-being. So we can see that her theory is also found to be complex in its scope and rigid in presentation, because the 14 basic needs express the basic needs and goals of nursing care, and the concept itself focuses on the nurse's role in patient care. The fact that this concept or theory focuses on a level of independence that the patient has had as baseline can be considered a complexity of the concept because it can be difficult to achieve for different kinds of patient populations. How these philosophical underpinnings influence the theory's development of her theory. One mid-range theory that could be considered in this concept is the normalization process theory. This theory focuses on how the things that that individuals and groups do to create and modify modes of practice interact with the environment. This can mean that the individual's environment contributes to the patient's feeling of normalcy, which helps the patient get back to a baseline level of independence. So we look at the analysis of the theory of our theorist Virginia Henderson. This description should be a synthesis that includes an overview of the theory. A patient is one who requires assistance to achieve completeness and wholeness of mind and body. The art of nursing is separate from physician practice. They do overlap as they create the healthcare team as well. There are 14 basic needs of the patient provided by nursing care. And these are the 14 concepts that we mentioned earlier, being normal breathing, adequate hydration and nutrition, removal of body waste, proper body posture, adequate sleep and rest periods, clothing appropriate for activity, maintaining a normal body temperature by adjusting clothing and temperature of the environment, protecting the skin and keeping clean and well-groomed, avoiding environmental hazards and injury, expressing your emotions, needs, fears, or opinions with others. And also this is your faith-based or worship of your faith, your religion. So analyzing the theory, we'll need to work to achieve accomplishments, staying active outdoors, developing good health habits, and using available resources. 3 levels of nurse-patient relationship are: the nurse acts as a substitute for the patient while healing, the nurse helps the patient while healing, the nurse partners with the patient for recovery. The meta-paradigm of nursing, health, patient, and environment. Henderson believed that the nurse played a distinctive role in patient care by providing assistance to the patient that they would normally provide themselves if they did not have deficits or if they were well. Henderson's concepts related to the nursing meta-paradigm of patient, health, and environment by defining the patient as an individual who needs care, including maintenance of environment in the aforementioned 14 activities and describing health as a balance in all facets of human life. In Henderson's nursing theory, the concept of nursing is based around the patient's needs as defined in a list of the 14 activities which set guidelines for nursing interventions and adjustment to environment in which nurses can assist the patient to achieve, and which can be an environment which the patient chooses. And we can also say that thoroughly describe the concepts, including the definitions and how these concepts are interrelated. How the concepts are related must be demonstrated, and these are important for the theory's framework. Henderson's 4 major concepts. The individual. An individual has basic health needs and may need support to reach optimal health, to achieve independence, or assistance in reaching a peaceful death. The individual is comprised of the 2 elements of body and mind. The body and mind are inseparable in the individual. The environment. It consists of the settings in which the individual ascertains as their distinctive design for day-to-day life. The environment can adversely or positively affect the individual and the individual's health. Henderson's 14 activities for client assistance are: breathe normally, eat and drink adequately, and we actually covered all this, including work in a manner that prevents a sense of accomplishment, play or participate in many forms of recreation, discover, satisfy, or learn the curiosity that leads to normal development and health, and use the available health activities. Other key concepts and sub-theories are: Henderson's concepts include her interpretation of the nursing process. Henderson's nursing process follows the assessment, diagnosis, planning, implementation, and evaluation model that is known to all,